Does cholesterol management differ for people with familial hypercholesterolemia? Have you ever wondered if managing cholesterol is the same for everyone? Well, today we are focusing on a specific group, people with familial hypercholesterolemia. This condition is hereditary and leads to very high levels of low-density lipoprotein cholesterol. In fact, adults with this condition often have cholesterol levels above 190 milligrams per deciliter. This significantly raises their risk of heart disease at a young age. So, how does cholesterol management differ for these individuals? First, the targets for cholesterol levels are much stricter. For adults with familial hypercholesterolemia who do not have heart disease, the goal is to get low-density lipoprotein cholesterol below 70 milligrams per deciliter, or to reduce it by at least 50% from where it started. For those who already have heart disease, the target is even lower, often below 55 milligrams per deciliter. Children over the age of 10 with this condition aim for levels around 135 milligrams per deciliter. Next, treatment starts early and continues throughout life. This is crucial because the genetic nature of familial hypercholesterolemia means that lifestyle changes alone are often not enough. While diet and exercise are important, they usually need to be combined with medication. Speaking of medication, the first line of treatment is typically statins. These drugs help reduce cholesterol production in the liver. High-intensity statins are recommended to achieve that 50% reduction in low-density lipoprotein cholesterol. If statins alone do not bring the cholesterol levels down, doctors may add ezetimibe, which blocks cholesterol absorption from the intestines. For those who still struggle to meet their cholesterol goals, there are other options. Injectable medications called PCSK9 inhibitors can help clear low-density lipoprotein cholesterol from the bloodstream. These are effective but can be more expensive. Newer medications like bempedoic acid may also be used to further lower cholesterol production. In severe cases, doctors might consider procedures like low-density lipoprotein apheresis, which filters cholesterol from the blood, or even liver transplantation. Another important aspect of managing familial hypercholesterolemia is family screening. Since this condition is inherited, testing family members is vital. Identifying others at risk early allows for prompt treatment, which can make a significant difference in their health outcomes. Lastly, traditional risk calculators do not work well for individuals with familial hypercholesterolemia because their risk is inherently very high. Regular monitoring of cholesterol levels and heart health is essential to adjust treatment as needed. In summary, managing cholesterol for people with familial hypercholesterolemia requires a more aggressive approach. This includes stricter cholesterol targets, early and lifelong treatment, and often a combination of medications. Understanding these differences is key to reducing the high risk of heart disease associated with this genetic condition.